That's huge, and it definitely doesn't seem very affordable.
A lot of website frustration, healthcare headaches, and KOIN 6 investigates tonight as thousands of Oregonians get letters about their health coverage ending altogether. Welcome, everyone, to KOIN 6 News at 6. I'm Kelly Day.
And I'm Jeff Gianola, and in many cases, providers are rolling patients into new plans that comply with the Affordable Care Act.
But Neil Simon found out those changes are not always affordable, right, Neil?
Yeah, Kelly, nobody expected the transition to a new healthcare system to be easy, but some people were downright shocked to see this. Premiums, in some cases, doubling. Studying to be a pharmacist, Lindsay McChesney was thinking of one thing when she and her husband signed up for health insurance: cost.
We picked the high deductible, lowest plan just because me and my husband are healthy. We don't use it that much, and going back to school, our budget is not what it used to be.
But then she got this letter from Kaiser Permanente saying due to healthcare reform, she would be rolled into new coverage with a new cost. Her $230 monthly premium would now be $491.
That's huge, and it definitely doesn't seem very affordable.
Seeing that new premium, we wondered what happened to the affordable part of the Affordable Care Act.
It's a confusing time. There's a lot of information out there.
State Insurance Commissioner Laura Cali signs off on the costs after a public rate review process.
Welcome to this public hearing to gather information.
This is not a new problem.
But State Senator Chip Shields, chair of the Senate Consumer Protection Committee, says more can be done to discourage rate hikes.
What the insurance commissioner needs to do is take a very fine-tooth comb to those filings, push back, particularly in the individual market where the person is out there swinging on their own, where they have very little protection.
Could you be doing more to keep those rates in check so the consumer feels like they've been protected in the rate review process?
While we do a lot, there's always more that we can do.
Hi, this is Jim.
Insurance division analysts and consumer advocates helped cut rate requests down by $69 million this year. But many consumers are still seeing costs increase. To make sense of it all, think of it this way. The old plans that expire are kind of like cramped seats in coach on a flight to Chicago. The new plans may cost a little bit more, but you'll have more legroom and they'll take you all the way to D.C. But many consumers are still seeing costs increase. We asked some of Oregon's biggest providers exactly what changes average Oregon families could expect when their 2013 plans end. MODA, Oregon's lowest cost provider, says the average Oregon family would be moved to a plan with a 15% higher premium. But that family would also be eligible for a subsidy, essentially making the cost change a wash. Providence Health Plans said members using their most popular plan will be moved to one that costs 19% less. But they'd also face a 50% higher copay and 30% higher deductible. Kaiser members on a popular plan will be moved to one with a premium that is 9% cheaper, but the deductible is 50% higher.
All things equal, I mean, you might see that younger people pay a little bit more and older people pay a little bit less before the impact of subsidies.
That's in part because the Affordable Care Act ensures that no seniors are charged more than 3 times the rate of the youngest adult on the same plan.
Healthcare still costs too much.
The Oregon Public Interest Research Group monitors the state's health insurance market.
We think the message to providers, to insurance companies, is you need to start thinking about how to change the way you do business to start getting that waste out of our healthcare system and bring down costs for consumers.
Consumers like Lindsay McChesney, who's now considering whether to ask for government help to pay for health care.
It's not what I expected healthcare reform to be.
All this is new. It really is the first time consumers can compare health plans side by side. And everyone I talked to did remind me of that simple fact. If someone can't afford the premium, there's now those government subsidies available to help them to make it more affordable.
Neil, thank you. Lots of information there. And to make it easier for you, we have uploaded one table at KOIN.com. You can see all the major Oregon plans and their average cost, and also some interesting data on how much extra they wanted to charge you, but it was rejected by the state. It's a great place to start if you try to decide on coverage for you or your small business in the coming year.